just going to do a traction and circumduction of Michelle's hip. And so we're going to have her laying on her back. And then for whoever at home, what you're going to do is you're going to support the ankle and you're going to go slow and you're going to pull it up and you're going to pull it slightly out, just about 20 degrees. From here, you're going to hold the ankle and you're just going to lean back, providing a gentle traction. And you can perform it with this little oscillatory motion and then just gentle back and forth. It'll be painful. Michelle, how's that feel with that pressure?
Good.
It's okay?
Yep.
So you mix it, so think back and forth about 20 times. And then you do these little oscillations. That's the traction portion of it. And then you add a circumduction movement, which is gentle circles. And this is just a tolerance. So you go clockwise and then counterclockwise. And Michelle, how's it feel?
Good.
Good. And then you alternate back and forth. So go back to the traction. You're doing these small little oscillations. Kind of lean back a little bit, provide a little bit of a distraction. And then you go back to your circumduction. And 10 circles in, 10 circles out. And try to do that for about 5 to 10 minutes, a few times per day. About 5 times per day if possible. And then nice and slow on the way down. Another one for gentle passive range of motion here. If you want to left in this. We're going to do gentle passive range of motion back and forth. And what we're going to do is take her up. Her limitation right now is 90 degrees of flexion. We're not going to go past that. And that's just the knee straight up towards the ceiling. Yep, and she's got a cramp right there. So keep her up. Okay. The biggest limiting factor for this one that we don't want is a pinching sensation in the front of the hip. Now, obviously, if she feels cramping like that, then don't mess with it. But if she tolerates it, which she should over the next couple of days as well, bring her up to about 70 degrees of hip flexion, and then you'll do some gentle circumduction here as well. That's just the fancy way of saying circles. Again, you're going to go clockwise and then also counterclockwise. Now, Michelle, if you feel any pinching, we're not going to go.
It's not pinching, but I feel it more this direction than the other.
Yeah.
Right on the inside.
Yeah, and then what I can do is I can also bring her out to the side just a little bit. Is that pinching the same or
No,
better?
it's gone.
Yeah, okay. So keep an eye on it. We don't want to just keep pushing into a pinching sensation. We're just going to go slow and steady. And we're still pretty early post-operative. We're 2 days out. And so we're going to keep it pretty gentle. And just think gentle rhythmic motion. And Michelle, make sure you tell me, and make sure you tell whoever's doing that just kind of what you're experiencing. This isn't something you just want to kind of bite your teeth and grit through. Okay? It's just back and forth. Yeah. Thanks.